Hi everyone, my name is Geraldine. I'm a registered nurse, a midwife, and a fertility nurse. If you are passionate about fertility, pregnancy, women's health, and reproductive education, then this video is for you. I want to share with you 10 interesting things about IVF. So, if you're trying to conceive, or you're supporting someone on their fertility journey, or you're just simply curious on how IVF works, you're at the right place. Number one, what is IVF? IVF means in vitro fertilization, meaning outside the body. Now, during an IVF cycle, a woman's egg is carefully collected from her ovaries, and a semen sample is also collected from the male partner or a donor, depending on the situation. Now, the egg and the sperm are brought together in a lab where fertilization can occur. When they grow into an embryo, it is then transferred into a woman's uterus where it can implant and grow naturally into pregnancy. So that is to say, the only part that happens outside is the fertilization. When an embryo is placed in the woman's uterus, it grows naturally, just like every other pregnancy. Number two, IVF is much more than a medical procedure. It's not just about the scan, the injections, the doctor's appointments, or the hospital visits. It's about hope after disappointment. It is about holding on to a miracle after so many months or even years of trying to conceive. So IVF is not just science, it's an emotional journey. Number three, IVF is not only for women. Now, this is one of the biggest misconceptions. Fertility challenge can come from the man, the woman, both partners. Even sometimes the exact cause is not even known, which is why fertility evaluation is very important so that a best treatment can be carried out. Number four, every egg collected does not become an embryo. Yes. Some people assume that if 10 eggs are collected, it will automatically be 10 embryos. Unfortunately, it does not work that way. The truth is, some eggs may not be matured enough, some may not fertilize successfully, or some might even stop developing before it gets to the stage where it is transferred or frozen. This is completely normal. This is why every healthy embryo is incredibly precious, and a fertility specialist will always take care throughout the process. Number five, IVF does not automatically mean twins or triplets. Number six, age matters in IVF, but age is not the only factor. That is to say, as women grow older, the quality and the number of eggs naturally declines, which can affect IVF success rate. However, younger women tend to have higher success rates, but age is just a piece of puzzle. Apart from all that, your overall health, fertility diagnosis, quality of sperm, and the quality of embryos plays important roles. Now, every person's fertility journey is totally different, so it's important not to compare your own with someone else's own. Number seven, healthy embryos can be frozen. Yes. Now, one very beautiful thing about modern IVF is that healthy embryos can safely be frozen for future use. This means that if the first transfer does not result in a successful pregnancy, or if probably the couple wants to have other babies in future, they would not have to go through the entire process of egg collection and all of that again. They will just use the frozen one. Frozen embryo gives many family another chance while reducing the physical and emotional stress of starting all over the entire process again, which is sweet, right? Number eight, one unsuccessful IVF cycle does not mean that you have failed. Now, this is what I really want people to remember. Most times, first IVF cycle may not lead to a successful pregnancy, which can be very, very heartbreaking. But that doesn't mean the journey is completely over. Many couples go on to achieve successful pregnancies after first, second, or even third attempt. Every cycle provides valuable information that can help the doctor adjust to a better treatment plan. Number 9, IVF babies are not different. Yes, they're real babies. They are just babies who came into this world with a little extra help from science. Apart from that, they are just as normal as every other babies. Number 10, and lastly, behind every IVF journey is a story that many people never see. Story of strength, patience, tears, resilience, and hope. So if you are going through IVF or you know anybody who is going through IVF, please choose kindness because you don't know how much that encouragement could mean. If you found this video helpful, please like and share with someone who might need to hear it and follow for more tips. See you in my next video. Bye.